All right, thank you, and thanks for joining us this Friday. As Quinn mentioned, the decision between Medigap or Medicare Advantage policy is something that every retiree has to deal with, and just about everyone has a question on. It's a topic that every retiree is harassed about, with phone calls and mailings, and it's one that we just feel has a lot of potential longer-term consequences, and so it's an important topic to cover. Just to start, I thought it'd be good as a quick review about why this is an issue at all and what exactly we're talking about with Medicare Advantage or a Medigap supplemental policy. And so these are policies that were created to serve a very important need in retiree healthcare. And so just to start and make sure everyone's on the same page about how these supplemental plans fit with the rest of Medicare, supplemental policies are made to fit on top of or in conjunction with these other main parts of Medicare. And so Part A is your general coverage for hospitalization. It's free for you if you've worked and paid into the Medicare system for a certain number of years. Otherwise, it does have a monthly premium, as much as about $500 a month. Part A, just on its own, also has a $1,600 deductible per benefit period, and that's not per year. It just depends on the time in between hospital stays. And so, just for example, if you were in the hospital, then went home for 60 days and went back into the hospital, that can be two separate $1,600 deductibles. But besides just hospital care, then there's Part B. So this is things like doctor visits, outpatient care, visits to specialists. And this has a monthly premium that changes every year. This year, it's about $165 per month and can vary depending on your income. Part B has its own small separate deductible that, again, changes every year, but is currently about $226. And so you can use only parts A and B for Medicare coverage in retirement. And you can see it would be fairly cheap insurance, $165 a month for most people. But just having parts A and B would leave some big gaps in your insurance coverage. And the bigger risk is that Part B only pays for 80% of your eligible medical expenses. And so that 20% remainder can still be a pretty significant sum. And, I just did kind of a quick Google search for the cost of certain medical procedures, and it's very easy to find things that cost $100,000 or more. And so even with just parts A and B, you might still be stuck with, $20,000 just in one of those examples. And then, of course, there's prescription drugs too, many of which are not covered by parts A and B and can be very expensive. And so supplemental Medicare policies exist just to fill this gap, mainly that 20% coinsurance risk and prescription drugs. And when you're shopping for these supplement policies, you have the first decision to make, and that's between two different types of supplemental insurance plans: Medigap supplement plans or Medicare Advantage plans, which are sometimes just referred to as Medicare Part C. These are very different options, and we're going to go through a lot of slides here to compare some more details and examples of these policies side by side. But just to start, as a very general comparison, here's some main differences at a very high level. Medigap policies are very standardized. There's 8 different Medigap options for those that are new to Medicare today to choose from. They're each identified with a letter. So for example, Plan G is one that we'll be looking at later. And every insurance company can sell a Plan G, but they must meet certain requirements. And so you can buy Plan G from Humana, Wellmark, Transamerica, and be pretty comfortable knowing what you're getting with those plans. They're not going to vary widely. This is not the case with Medicare Advantage. There's many more options to choose from and many more differences as far as deductibles and premiums and coinsurance and out-of-pocket maxes. There's just going to be a lot more variation in these plans. Another big difference is that Medigap policies have an advantage in that there is hardly any in or out of network care providers. If your doctor accepts Medicare, your Medigap policy will be there to provide coverage. Medicare Advantage has much more restrictive networks. And so we're going to look at an example in a minute here, but if you like certain doctors or hospitals, it's very important to find a policy that's at least in network with your desired care provider. And this is also a potential problem if you maybe travel frequently or are out of your local area a lot. Besides the restrictive networks, you generally need to have referrals for visits of any kind of specialists or special treatment with Medicare Advantage policies. This just means more doctor's visits, more potential co-pays, and we'll look into all this in a second. But lastly, Medicare Advantage is commonly thought of as an all-in-one solution to Medicare coverage. When you buy an Advantage policy, it will probably be bundled with many other aspects of your health insurance needs. So it might include prescription drug coverage, it might include Part A and Part B, and vision and dental, maybe even hearing. This is not the same with Medigap. If you buy a Medigap policy, you will need to buy a separate prescription drug policy. If you want dental insurance, you'll have to buy a separate dental policy, and so on. So with that in mind, just kind of which one's best for you, how do you go about determining where to look? And if you start Googling or just pay attention to anything on TV, you're going to come across a lot of ads with big name celebrities, touting these Medicare Advantage plans. And with these, you're inevitably going to be focused on one item, and that is zero cost, Advantage plans, or $0 premiums, no deductibles, no co-pays. And at the very least, these numbers are going to get your attention, right? And, if these ads on TV or the internet don't get your attention, the mailings and phone calls might. And as you get close to 65, you're going to be bombarded with ads like this. And again, they're going to focus on one primary thing generally, and that's a very low premium. Nearly 50% of Medicare enrollees are in a $0 monthly Advantage plan as of this year. So this is, obviously a very big driver in sales, getting people's attention, getting people into these types of policies. And you should be skeptical about this, of course. Everyone wants to know, what's the fine print with these $0 monthly premium plans? How do they work? Why should I pay a lot for other supplemental plans if I can pay $0 for these? And so I thought the best way just to show this would be to take a few of these Medicare Advantage plans and just look at the details side by side with Medigap plans so you can see the difference in how these plans will work. And so for both of these, for the rest of this presentation, I just did a search for a 65-year-old male in Iowa City, Iowa, and saw this policy here, this Humana policy, as one of the 20 or so that was available. It's a highly rated policy, so I don't think we're cherry picking here, finding a notoriously bad policy or anything like that. Most importantly, this is one of those $0 per month Advantage plans. And so just some quick things to consider as you begin to review these policies, and a few things just to know about these $0 monthly premium policies. A few of these bullet points, we're going to get into some very specific detail later, but again, just kind of as a high level, some things to know about this. These $0 premiums do not generally include your Part B premium, or at the very least do not include all of it. And so you will still be paying that about $165 a month fee. So don't think you're getting out of paying for that. Also, that $0 premium may or may not include prescription drug coverage. We're going to get into some specifics in this in the future, but know that that may be something that is a big expense in addition to this $0 policy. A big one here is what care providers are in network. So I mentioned this Humana policy we're looking at is eligible for purchase for someone in Iowa City. And in this policy, no care providers associated with the University of Iowa are in network at all. And so this might be a very big deal for you and would be something you would really want to know and be comfortable with before you buy this policy, that anytime you go to a University of Iowa hospital, you're out of network, which we'll see in a minute is going to add a lot of potential costs to this plan. And just as a final point, there's no guarantee that a $0 premium lasts forever. Companies can offer this $0 premium because payments they receive from the government can offset the relatively lower cost of care they're able to get just with the negotiations of their small networks. But if their costs become more than the payments they receive, your $0 premium will increase. And so there is no guarantee that you're signing up for the rest of your life for a $0 premium. But just shopping for health insurance based solely on premium is dangerous. And so we'll start to see why as we look deeper into these policies. But just for something to compare to, Plan G is a Medigap policy. It's one of the more popular Medigap policies that are there, and also one that has more thorough coverage. And so I thought it'd be a good one to compare against these relatively cheap or free Advantage plans. And so just to go through some of the basics here, Plan G has, again, for a 65-year-old male non-tobacco user in Iowa City, expect some kind of monthly premium around $140 per month. And again, this Advantage plan, $0. This is unfortunately what a lot of people focus on and make their decision on. Why would you pay, $140 a month, $1,800 a year or so, when you could get other insurance for $0, right? But as I said, shopping just based on premium can be dangerous, and here we'll start to see why. Plan G that you're paying that $140 a month for has $0 copays, 0% coinsurance for any Medicare approved expense. And so those in Plan G do have to still meet that $226 deductible for Part B, but after that may find themselves paying very little out of pocket for, again, Medicare approved expenses. And this Advantage plan has many different copay and insurance amounts depending on the service that you need. And we're going to start to see how that can really add up. And, looking at the bottom here with the max out-of-pocket expenses that you have should start to clue you in that we're going to start being subject to pretty significant expenses with this policy as we start to get care. And so just for example, in this policy, we're going to be looking at has a max of about $9,000 for out of network expenses, about $6,000 for in-network. And we're going to see very quickly here that this free Advantage plan is going to end up getting very expensive when you need to start having medical care. And just for example, let's start saying, assuming you end up in the hospital for some reason. For Plan G, you pay nothing for up to very long hospital stays. Plan G also covers that $1,600 Part A deductible as well. And so with this Advantage plan, you can see some costs are going to start coming to you now. And so just for example, if you're in an in-network hospital, you're going to pay $425 per day for the first 5 days you're in the hospital. And if you're out of network, now you're subjecting yourself to maybe a pretty big bill, right? 40% of the costs of your hospital stay. And very quickly, probably going to hit that max out of pocket and make up for that cheaper premium that you've been paying or paying nothing at all with this Advantage plan. And so, with this Advantage plan, you're potentially on the hook for some pretty big bills. And, there are 20 pages and a lot of these 20 plus pages and a lot of these plan documents. There's obviously a lot of different types of medical care that you need. And so hopefully hospital stays are just a small part of your insurance need, but copays and coinsurance are going to exist for all the different types of care that you need in retirement. And so every time you need a blood test, every time you need lab work, every time you go to urgent care, every time you need a wheelchair or an x-ray, you're going to be hit with copays and coinsurance, especially large coinsurance if you're out of network ever. And so again, this is going to just depend on your medical care. Obviously, everything is a little bit different, but at the very least, be sure to spend some time in these plan documents, in these Advantage plan documents, to make sure you understand what you're on the hook for and be comfortable with that. Because most of these that I'm showing here on this Advantage plan would be fully covered with that $0 copay, 0% coinsurance with that Plan G Medigap policy. Another reason people are attracted to Advantage plans is that they very often include prescription drug coverage bundled with your other health insurance. And so again, a lot of people think, hey, it's $0 per month. I'm getting health insurance and prescription drug coverage. And if I had purchased a Medigap plan, I'd have to buy another prescription drug plan on top of this Medigap plan, which is just going to be more expensive, right? So this is a no-brainer to pick this lower cost plan. But again, you have to understand that $0 premium is getting you potentially much less in coverage than a policy that you would have to pay for. And if you actually need to start taking prescriptions anytime in your life, it's probably going to actually be cheaper to have an additional prescription drug plan that provides some robust coverage. And so just for example, let's say you get put on a statin. I just typed in a certain brand of statin here to get some estimated costs. Obviously, costs are going to vary widely based on what types of drugs you are on. This is very easy to see on the Medicare.gov site. You can type in any prescription that you want, and it will show you the estimated costs for any of these plans. So right away, assume your doctor prescribes 2 milligrams of the statin every day. If you purchase a separate prescription drug policy, in addition to your Plan G, I put a screenshot here on the left side of what your cost would be for this, and including insurance premiums and any out-of-pocket expenses, you would be on the hook for about $760 for this drug. If you had selected that $0 Medicare Advantage plan, you get much less than coverage. And then looking here, I showed down at the bottom, you would be on the hook for about $1,900 in drug costs. And this is even with an in-network pharmacy that you were able to find. And so, again, you can see here very quickly that $1,200 in difference here all of a sudden is making this free Advantage plan potentially very expensive. And we have a separate webinar that we've done on Part D, the prescription drug plan with Medicare. It's going to be a little too much to get into the specifics of Part D, but be sure to watch that. And as Quinn said, you can find that on our YouTube channel. But just as a very quick summary, purchasing a separate Part D plan has a lot of advantages, we think, just because of how you're able to shop for Part D plans every year. Standalone Part D plans can be very inexpensive for those that are healthy, somewhere around $10 to $15 a month, and can be there to provide coverage if you need, and seems to provide much more robust coverage than the free plans that are there in your Advantage plan. And then lastly, when your prescription drug plan is kind of bundled in with all your other insurance, it can become a big hassle if you just want to switch prescription drug plans, right? Now you might have to change all of your insurance, and which we'll talk about in a minute, that might not even be possible to do if you develop certain health issues. And so that the issue of Medigap policies not providing prescription drug coverage may not be that big of an issue at all, really. Another part of Advantage that often seems attractive at first glance is that it includes coverage for things like dental and vision, maybe hearing. And again, coming with a free policy seems like a good deal, right? If you're on Plan G, you're going to have to purchase a separate vision plan if you want vision insurance. And so, but the first thing you want to look at is what does that free policy actually pay for. And so you want to start looking at some of the co-pays, looking at which doctors are in and out of network. And like the previous slides, the bigger issue here is just going to be what coverage are you getting? And so just for example, this particular Advantage policy only covers you up to your first $75 per year for routine eye exams and a max of $100 for contacts or glasses if you are in network. And so it is coverage, but will certainly still leave you with out-of-pocket costs most of the time. And, so might be a benefit of $8 or $10 per month effectively. And if that means you have to go to doctors you don't want to go to or pick subpar health insurance or prescription drug coverage, is probably not worth it. And so again, at the very least, just be sure to read the details on your Advantage policy to make sure you're comfortable with the coverages and understand what benefit you're getting, because a lot of the time it's not as robust as you might think and what you're used to with maybe employer vision plans and things like that. So the numbers we looked at in the last few slides, of course, are always going to vary depending on your medical needs, but a few things can be summarized, just kind of comparing between the two. Plan G or other Medigap plans in general are going to be more expensive if you're perfectly healthy, but they can save you significantly when you're sick and can just be easier to work with, not having to worry about in and out of networks and complications like that. Advantage plans will very likely save you money when you are healthy, but when you need to use that medical insurance, you might be at risk for a lot of high out-of-pocket expenses. And so as you begin to decide between these two, I think it's important just to think about what the role of insurance is in your plan. And this goes for any type of insurance, not just health insurance, but you rarely want the cheapest option available or the lowest coverage available. But that seems to be what people flock to with health insurance for some reason. And, no one thinks that when it comes to home insurance, you should get a very cheap policy that only protects you for, $10,000 for the value of your home. I think we'd all say you want home insurance that if your house burns down is going to pay for at least the vast majority of expenses to rebuild your house, right? Likewise with car insurance, if you could buy an auto policy that was only $5 a month, but it only protected you for a couple $1,000s in damages, would you want to buy that? Probably not. Most people would stick with something more traditional. Life insurance, a $5,000 term policy is going to be a lot cheaper than a $500,000 policy. But no one buys insurance based on the premium, right? You buy based on the level of coverage that you need to protect your family. And that mindset, we believe, should be the same for health insurance. You absolutely can get very cheap health insurance in retirement, cheaper than the Medigap policies that exist. But when you need it, it's not going to provide that same level of coverage. And so just with that in mind, we tend to feel that these Medigap policies provide better protection and peace of mind, making them, worth that cost for most retirees. One other kind of question or strategy that people like to think about in retirement is kind of knowing the differences in these policies and the potential premium savings from an Advantage plan is, can I initially start in an Advantage plan and then in say 5 years, switch to a Medigap plan and try to save some money that way? This strategy has some significant risks, and there's certainly some things you should know about before you do this. The most important and the most obvious is that outside of your initial enrollment period into Medicare, providers can underwrite you and deny you coverage based on health conditions. And so when you initially enroll at age 65, you can buy Plan G, not worrying about your medical history. If you try to switch at age 72, that may not be the case. They can deny you then. And so, we of course never know when we're going to become sick or develop any health issues. And so it can be incredibly risky to try to time this, right? Stay in a cheap plan until right before you think you're going to need good health insurance. Because if something does arise early on before you make the switch, you're going to be stuck in your current health insurance plan and potentially a very, subpar insurance policy that's going to leave you on the hook for some of those higher out-of-pocket expenses that we looked at earlier. And then just lastly, there can be late enrollment penalties for various supplemental policies like prescription drug coverage. And so if you don't enroll in that early on and try to get in later in retirement, there are penalties that you will pay for the rest of your life. And so it can just be another reason not to try to save a little bit early on by avoiding some of these insurance policies. And so this is the reason that we make a focus, with our clients to talk about this, have a meeting about this before you're ready to enroll or, anytime in our engagement, because making the right decision the first time can save you a lot of money and prevent a lot of hassle from, maybe getting stuck in a bad situation for the rest of your life if you just have some untimely health insurance needs. And so there, I think this went a little long. Thank you for sitting through this. Hopefully this was helpful just to give you an idea of some important things to look at as you are considering these policies. And then of course, know that we're here to help give you, some advice and second opinions on the best course of action for you. So thanks for attending. If anyone has any questions, we're happy to help. Otherwise, have a great weekend. Thank you.